We will call the Health and Human Services meeting to order. And can we have roll call, please?
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Killeen.
Here.
Chair Baker McCormick.
Here.
You have a quorum present.
Thank you. Next item, please.
Chairwoman's remarks.
I have no remarks. Next item.
C, approval of the July 27, 2021 meeting minutes.
Is there a motion?
So
Move
moved.
approval, Madam Chair.
Support.
Support Commissioner Marecki.
All right.
Whatever.
Yeah, whatever.
Been
The
moved.
minute taker can figure it out.
All those in favor, we'll take a voice vote. Aye.
Aye.
Anyone opposed? No one opposed, motion passed. Next item, please.
D, unfinished business. There is none listed.
Thank you. Next item.
Item 1, under new business, an update regarding COVID-19.
All right, who do we have today? Is Director Jordan on the line or?
I am.
All right, well, welcome. Can you state your title and name and go right ahead with your update?
Thank you. My name is Melita Jordan, and I'm the director for the Wayne County Department of Health, Human and Veteran Services. I'm going to provide the COVID-19 report for August 15th through 21st. In terms of new cases, over the past week, there's been a total of 1,208 new cases reported with 4 new deaths identified. And of those new cases by gender, 53% were female and 47% were male. Our cumulative cases have been 106,917 cases and 2,549 deaths since March 2020. We have provided 1,699,745 COVID tests, 1,613,443 were diagnostic, and 86,302 antibody tests have been administered to out Wayne County residents since March of 2020. The county averaged 2,414 tests per day over the past week, with the state of Michigan averaging 2,060, and Detroit has averaged 1,771 tests per day. Our percent of positivity, I have not received today's positivity. It normally comes in shortly after 3 o'clock in the afternoon. So I'm reporting last week's positivity rate of 7.6% over the past week, which is an increase of 0.9 percentage points from the previous week. Our daily cases, we continue, as I mentioned, to see from the previous report, an increase in our daily cases per 100,000 population over the prior week, averaging 113 cases per day in out Wayne County, as compared to 94 cases per 100,000 from August 1st through August 7th. According to CDC, we are ranging in the classified as the high transmission per CDC, and that also includes, of course, Detroit is included in the numbers from CDC. So not just the out Wayne County or the 42 counties that we are covering. Our top municipalities for the new cases last week was Dearborn with 157 cases and 13% of the total cases, followed by Dearborn Heights with 94 cases, which is 8% of the total cases, and Canton Township, 87 cases, again showing 7% of the total cases, and Livonia, 83 cases, which is 7% of the total cases. In Westland, 76 cases, 6% of the total cases. In terms of our variant, there were 1,576 total lab confirmed variant cases. 91% was the Alpha B117 or the UK strain, followed by 3% of the Delta B16172 or the India strain, followed by the 2.5% the Gamma P1 or 2% of the Epsilon. Where our California strain was B1429, B1427 was less than 1%. We also had an increase of 15 Delta cases that was identified from the previous week, giving us now a total of 53 of the Delta variant. And again, as you recall, that is based on the samples that are performed. So therefore, at this point, according to the most recent information that I have, that we do have 53 total cases of the Delta variant in the county. Our vaccine coverage, the county vaccination rate is 67.7% for those with the first dose and 61.6% for those with a second dose. Again, by age, our individuals that are 65 years and older have the highest vaccination rate, while again, our young people between the ages of 12 and 15 have the lowest vaccination rate at this time. Our breakthrough for the rate in Wayne County is less than 1% of those vaccinated. In the county, there has been 1,710 total vaccine breakthrough cases that have been reported. Of those, 32 deaths, 59 hospitalizations, and 59 hospitalizations, I'm sorry. And then the Wayne County breakthrough cases made up 12% of the state's total of 14,583 breakthrough cases. We are still administering the in-home vaccination. So to date, we have administered 284 of the first and second doses at home, including 67 of those being the Johnson & Johnson. We have also, as of yesterday, started to administer the booster vaccine at all of our sites. And we will be doing so Monday through Saturdays. And the information is on our website of the number of areas or sites that we currently have, in addition to the phone number to call for an appointment, although not necessary, is 1-866-610-3885. Again, that call center number is 1-866-610-3885. An appointment is not necessary in order to get the booster vaccine for those individuals that are immunocompromised.
I want to get fucked by a man. Fuck me in my butt.
All right, we have someone. Can the clerk delete that person?
I did.
Thank you. Madam Director, you can continue. We apologize for that.
So the COVID-19 vaccine, again, like I said, is available for those that are moderately or severely immunocompromised. And we are at all of the sites, but in addition to that, the local pharmacies, along with providers across the county, in addition to some of the supermarkets that have pharmacies, are also providing the booster doses as well. And this is for individuals who have previously received the Moderna vaccine, 18 and over, and or the Pfizer at 12 years and older. Any questions?
Thank you for that update. For the county, is there any mandates that you see being put in place by the health department that will require some type of vaccination or a passport, or are we just following the CDC guidelines and state guidelines?
We have been following the CDC as well as the state guidelines on the 100% mask face coverings inside buildings where there is, again, large gatherings. In addition to for our schools, we have sent out a health advisory on the 17th for 100% mask face coverings for our children in schools. That's correct. And as again, the information that we get on a daily basis from the information that we get weekly from the Department of Health, the Michigan Department of Health, will be coming through later this afternoon. And so I anticipate getting new numbers before the end of the day, should be after 3 o'clock. So I'll be able to take a look at the additional data at that point.
And do you have any data on our young people under 12, our children under 12 that have died from the vaccine?
I have requested that information. I have not received any hospitalization information in terms of our pediatric intensive care units that have had children admitted with COVID and or have died from COVID.
Okay, so we don't have
that information has been requested from the state.
Okay.
If I get that information, I'll be able to pass that along. And of course, we certainly will be looking at that information if it's provided to us.
Thank you. And we have Commissioner Colleen and then Commissioner Dodd. Go right ahead.
Thank you, Madam Chair. And good morning, Director Jordan, or good afternoon, or whatever it is. Happy someday that ends in Y in this COVID time. And I would like to get the numbers from you, Director Jordan. Didn't see that up there today, but I also want to dig into those numbers a little bit with you, because the numbers themselves don't necessarily tell the story here. Did I understand you to say you've issued a mandate for mask wearing in Wayne County?
I did not. What I did say is that we issued a health advisory. A health advisory was released on August the 17th.
Yeah. And it's basically the same one that the state of Michigan has and basically what Oakland County has done. And you've already mentioned that the CDC says we're in a high rate of transmission in this state and in this county in particular. The University of Michigan School of Public Health has projected that the infections are going to continue to increase over the next 4 to 6 weeks. They did not say anything beyond that. Are you familiar with that? And does that sound right to you?
I have been looking at that. And also, as I mentioned earlier, the numbers that the CDC also report does include Detroit. And Detroit does have a very low uptake at this time. Yeah. And so that does influence clearly the way that it is looked at. It does not separate out Wayne County, 42 counties from Detroit. So therefore, the numbers is showing that we are high based on the positivity that we currently have, as I mentioned, is from a week ago. I am looking, like I said, to receive the other this afternoon, and we'll make that available as soon as I do get that information. I'll be taking a look at that as well. In addition to, we have looked at the hospitalization in terms of beds of availability so that we still have capacity in the state. I am waiting to get information also on the number of adults that have been admitted to intensive care units and or on respirators. And so we are looking at that information as it comes into us, is to be able to evaluate that as well. And recognizing that, yes, transmission is high through droplets. Clearly, when individuals do not wear masks indoors or at this point in certain areas, that can be an area or a source for transmission.
You know, and given your response there, I'm thinking we're looking at too many trees and missing the forest here a little bit. So we are going to be seeing increasing of infections, and that's been going up pretty significantly on a week by week. I want to comment on a couple of things here. The Monday report has always been low coming out of the state of Michigan for data that they collect over the weekend. In fact, M Live, when they report that, point that out. So, you know, so if you're watching this, the Wednesday and the Friday reports from the state of Michigan on the numbers in this state are going to be more accurate than the Monday report, which is low. Now, you did mention we don't have the percent positive current number. What does, Ms. Jordan, what does percent positive in the testing tell us? And what does that tell the health community, the hospital, the doctors? Why is knowing percent positive, of what value is that?
The value of it is around the transmission, the transmissibility of the virus within the community. And so that we are following that. And I do recognize that the data comes out twice a week, but I'm looking at not just that. I mean, I'm looking at all data points that are being provided. So
yeah, I'll walk you through a couple others, but I want to stay with this one for right now.
Sure.
The hospital systems also look at this number, right? Is it not predictive
That's correct.
for how many people are going to show up in their hospital over the next week or two?
That certainly is a possibility, absolutely. That
Yeah.
the number of people that certainly show positive, yes, that they can show up in the hospital.
And then from public
And
health,
we are looking
folks,
at the number. Go ahead, I'm sorry.
well, I say, I'm looking at what public health officials are saying. And a number that I see quite often is 5%, that when you reach 5% positivity, that's when public health officials say, Houston, we have a problem here. Is that 5% number, am I accurate in what I'm reading about this, that 5% is kind of like, uh-oh, if it rises beyond that?
The number varies actually dependent on the data points that we're actually getting. And so when we look at the Nicker scale and the that was previously used, it had 5% actually being, that number was moderate. And so 5 to 7 was moderate. And so at this point, like as I said, as we tend to go up, we are certainly looking to implement additional measures as those numbers continue to increase along with the case count. And so, yes, I am very concerned that, yes, we are seeing a higher case count each week, which tells us, based on the number of people that are being tested, that we have more transmissibility within our communities.
Well, and I'm going the same direction that Chair Baker McCormick is going towards the end here. At what point do we issue a different order than we have today? Now you gave me a 5 to 7 kind of being moderate. Your number, we're already over 7, but we don't have the current one. The last one I saw from the state on Monday was an 8.1%. So, you know, and that's all telling me too, that the wave is coming, it's building, the wave is still in front of us. And I don't want to have a lot of the hospitals fill up and a lot of nonsense over opening and closing and fist fights in parking lots and all of that kind of stuff, and issue orders after the horses are out of the barn that are too late. I think in public health, we try to protect the public health and not wait till it's too late. Am I accurate in saying there are more, and well, there are more and perhaps nastier variants coming than the Delta, since well over half of the world is still defenseless and the Delta is taking over the world? Is there any doubt in your mind as a public health official that there are nasty variants out there, perhaps even nastier than the Delta, that can emerge at this point?
Commissioner Killeen, As you have asked me each week, we know that there are other variants out there. We know that we're a global society, and we recognize too there are places where people have not yet been vaccinated, and certainly it can come into our communities. I am just as concerned as you are as well, not trying to wait and overburden our healthcare system. And we'll certainly make sure, again, that we will address the issues as we are able to get the information that's needed. And we'll certainly provide that information to the public as well. And we are clearly following and trying to make sure that we have all of the information that's necessary for us to put in place then a mandate. And preparing for that, with the anticipating that maybe the numbers will be higher this afternoon. And so therefore I am prepared to put to the public another advisory that will maybe stronger than the one that you've already seen. However, we do have mitigation steps in place as well. So we have issued the mitigation pieces. Again, it's not just wearing a mask, as you well know. And so we will continue to encourage people to follow the mitigation measures that we have already instituted.
And again, Director Jordan, I'm not questioning you here. I'm questioning you, but not questioning you, if you know what I mean.
I understand.
Last Thursday, there was an excellent op-ed piece in the Detroit News from the health officer. I guess up in the UP, 3 or 4 counties go in together to have one health department. And he was saying, and let's be honest about this, this has become totally politicized. You know, threats of people at meetings, at their homes, being called up on the phone, right? And so now we're in like, you know, the pitchforks and torches crowd are out there. So I'm very sensitive to the fact that everybody is in the crosshairs here, right? And I do want to raise these questions, and I want to show my health officer that there is support for orders that you may have coming out. I'm enormously concerned here. The American Association of Pediatrics and just about every other group of doctors and nurses in the country has said we need a mask mandate. I'm just putting that out there as a baseline. I do want to ask you, however, under the public health laws in this state, Dr. Jordan, and I know you just kind of got here, but I think it's probably similar in other states. Under our public health laws, what role is there for school boards in those laws?
Actually, I have Carol Osterberry on the line. She can answer that for you. She is actually the health officer. As you know, I am the director over this, but Carol is the health officer. So I would turn to her to answer that question because I really don't know that. But I also want to say to you is that as I am still fairly new here, but I have been taking the opportunity to make sure prior to going to a mandate to make sure what enforcement I have. And so again, it is important because again, if we are to mandate, there has to be an enforcement. So working very closely every day with our staff here, our attorneys here, to also look at that process as well in terms of how do we also enforce that which we are putting into place. So again, I am very, very much concerned as you are, but I also need to do due diligence and making sure that we have everything in place. Just as you're asking those questions, I need to have answers for the questions that are being asked. And so if I jump the gun prior to having all that, I would suspect that you would ask the same question. Melita, how do you plan to enforce this? And so I am meeting with people to get those answers so that when it does happen, we can move forward with an enforcement.
Well, and I'm glad we're having this conversation for that very reason, Ms. Jordan, but certainly that's one of the issues here is that no matter what goes on, we're just going to have X% of non-compliance out there. So I'd be happy to work with you or understand what the compliance may be down the road should we get there. But I would like to hear from our health officer, Ms. Osterberry, on the question of what role under the public health laws of the state does school boards have in that law?
Yes, Carol Osterberry, Health Officer, HHVS, and that as far as under the Michigan Public Health Code or law, it's if anything, a collaborative role between your local health departments and your school boards. School boards are publicly elected, independent, bodies. So as far as, it's that collaboration, there isn't, any sort of a, specific role identified for them. We have worked since the beginning of this very closely through RESA, the Regional Education Services Agency in Wayne County, and have been able to, have great communication, quick, emails out to the listserv distribution for all the superintendents in Wayne County. It has worked very well as far as, that communication back and forth between your local public health department and the, the school superintendents, the school boards. We, have, like I said, really established a good working, open, relationship with RESA, with the superintendents and, obviously the superintendents for the school boards.
Well, and I'm sure you're having those discussions with the hospital systems as well, correct?
Yeah.
Yeah. But I do want to point out here, Ms. Osterberry and Ms. Jordan, the responsibility for this under the law is the health department. And I am very leery of having health departments basically taking a pass. Yeah, we have a strongly worded, just like the state does, and just like but certainly there's jurisdictions all across this state that have said, yeah, and this country, we're going to have a mask mandate. I'm just real leery of leaving this decision to school board members who, aren't necessarily at all health professionals, and putting those folks in the crosshairs. I firmly believe that this decision should be where the law puts it, and that's with the state and the county health officials. I must say I'm not exactly happy that Carol, your contemporary at the state, Dr. J, as they call her, Dr. Calhoun, has said we need to have a mask mandate, but her boss won't pull the trigger on that. So I've got a health officer from the state saying, yeah, we do need to have a mask mandate. But I think this just speaks to how this has devolved into not a health debate. It's turned into a political debate for other reasons. I will also note today that the National Guard in Kentucky has been deployed by the governor to assist in the hospitals down there. Another item in the news today is Baltimore County just issued a local state of emergency with regards to this. And so I'm not going to ask for the answer today, Director Jordan, but I'm in the same frame of mind that Commissioner Baker McCormick is, and that is, and I know we're not going to be able to do this with exact numbers today, at what point do we mandate masks? But I want to keep that very much alive. Numbers are going to go up next week. They're going to go up the week after that. The week after that, kids are going to be going back to school. For my money, this is going to look really different 3 weeks from now. We can see it coming, but maybe the numbers are scary enough that local folks make some other decisions. But it's a freight train, and we've seen it other places. And without 20% of Michigan going out and getting vaccinated in the next week, there's nothing to stop the train. That's what this variant is doing. So
thank you, Commissioner Colleen. Thank you so much. Did you have another question? We have a lot of public comments as well to this.
Well,
so.
I understand that. Yeah, but I wanted to have more of a, let me just check my list, Madam Chair, real quick, just to see if I missed anything here. All right, we'll let it go for now. And, but yeah, because I got colleagues I know that want to also weigh in on this, but just very
Thank you.
concerned. Thank you, Madam
Yeah,
Chair. And thank you, Carol and Ms. Jordan. Thank you very much.
You're welcome.
All right, Commissioner Dodd.
Thank you, Madam Chair. So I've got some scattered notes here that I'm going to try to go through in a somewhat comprehensive matter. I completely agree with Commissioner Colleen in that the county needs to be the leader here in putting out the mask mandate for our public schools. We need to protect these unvaccinated children who are going back to school, they're going to be spending hours and hours at a time together indoors. And yeah, and I understand masks are only one of the mitigation factors that we can put into place, but it is a very important one. We can't leave this up to each individual school board. It really should come from the state, but it's not going to. So we need to be a leader here and put a mask mandate in place for schools. You said that we're already in a high transmission phase in our county. The CDC and the Michigan Department of Health and Human Services are already recommending universal masking by all students, teachers, and staff and visitors in schools. So I don't understand why we're not following that guidance. And you know, like we're going into the school here really, really soon. People need this guidance from us now. And let me just, sorry, I'm not done. Let me just pause to read through what I've written here. We know that unvaccinated people should be wearing masks indoors. Our children under 12 are unvaccinated, so they should be wearing masks indoors. We've seen several counties in the state of Michigan who have already issued mask mandates for public schools. Kent, Genesee, Kalamazoo, Allegan, and Ottawa counties. And so I guess my question for you, Director Jordan, and for Carol Osterberry is, what other information are you looking for, or what are we waiting on for us to make that mandate?
Well, first, let me respond to your initial question. One, we are doing also exactly what the state as well as the CDC have recommended. So you're saying that you're not, so you're saying that I have not put out an advisory recommending 100% mask in schools as well as in indoor spaces. We have done that. So what's different than what you're saying that I have not done? I have done that. I have not deviated at all from that.
Because the MDHHS recommends that schools adopt policies to require universal masking, and we're not requiring them to do it. We're just saying we recommend universal masking.
We strongly recommend universal masking in schools and indoor masking in any crowded space.
But the key word is require. We're making
Also,
it, we need to make it mandatory.
Commissioner Dobb, along with the other mitigation strategies, we are asking the school districts also to submit those their mitigation strategies to us, that we can review and comment on their mitigation strategies for face masks, for distancing, for ventilation. So we are still encouraging those mitigation standards as well to make sure that we can continue to protect. And as I mentioned, I will be taking the additional information that we have, and also to say that this is a partnership with all of us. It's not just the local health department or the county health department. It is all of our responsibility to work together, all. But I think to point fingers and to suggest that it's just the health department that needs to do something, we all have a level of responsibility, including our commissioners, including our legislators, including the state. And so therefore, we are continuing to make sure that we can get the information, and I will get it out to you immediately. And I am working, as I mentioned, with this staff, along with our, the internal staff here at the department, so that we can provide the required follow-up that's needed as it relates to enforcement and as it relates to continuing contact tracing, as well as additional testing throughout the state and canvassing.
Do you agree that unvaccinated people need to wear masks indoors?
Yes, I do. And I've read, I think about 30 journals in the last 24 hours, keeping up with as much information that is coming out from across the country and as many of the studies that have been done. And so therefore, as I mentioned to you, we are working 24/7 to address this issue.
That's all I have. Madam Chair, I don't know if you got my message from earlier, but I believe
did.
I
did. I got it.
Okay, thank you.
No problem.
That's all I have. Thank you.
Okay. And just to clarify, Director Jordan, do we know what the policies are of each of the municipalities, the school districts, as far as mask mandates, or because some school districts are mandating, some are not? Do we know that, or do you know when you might know if you don't know?
Yeah, I have asked, Carol has reached out to RISA as well as some of the districts to get that information. So we are getting and compiling that information currently, as well as asking them to send their mitigation strategies to us.
Great.
And so I probably could have a fuller report probably by the end of the week, and we certainly can send it to the commission to let you know how many of the schools.
Thank you. And Commissioner Colleen, did you raise your hand again?
Thank you, Madam Chair, because I was going through my list after I was like, wait a minute, I have one more. And Director Jordan and also Ms. Osterberry, at least this commissioner's not going after you, right? And I recognize exactly what you're saying, Ms. Jordan, but unfortunately, this has become the kind of discussion it's become. So let me put this out there for you, Director Jordan. Literally, hundreds of millions of people around the world are going to mask up today. Do masks significantly slow transmission of the virus?
According to the report that I have read, it does. Absolutely.
And then to go along with that, then, what are the medical dangers in wearing a mask?
What are the medical dangers of wearing a mask? Well, it depends on, again, if individuals have perhaps asthma, certainly reduce the aeration and have a response to that. So there are certain conditions where, again, a mask can be problematic for some individuals, as well as individuals who have COPD.
But we're talking about a fairly low percentage of the population, correct?
No, we have a significant number of children and adults that have asthma, as well as a number of adults, of course, who have COPD. I don't have the exact number in front of me to tell you what that percentage is.
Well, that's one in which the city of Detroit will have higher numbers. But But given the fact that mask wearing is very common around the world and has been for a long time for a variety of issues, the dangers you have pointed to COPD and to asthmatics. Are there other categories where masking is a normal, healthy 12-year-old is masking a problem medically? Have we seen that?
I can't comment on it at this moment, but I'll be happy to get back to you, Commissioner Colleen, on that particular question.
Well, and I'm just thinking in terms of the decision-making matrix, right? Because a lot of this is balancing balancing some issues out there, no doubt, as you have pointed out. But I just wanted not to let this go by without at least discussing that issue a little bit. Everything that I've seen overwhelmingly, there's no medical issues wearing masks. There are a few exceptions in that. But anyway, thank you for letting me back in, Madam Chair, and thank you, Dr. Jordan.
All right, and it looks like Commissioner Dobb, you had another question?
Yes, thank you, Madam Chair. I'll make it really quick. Actually, my question is for Commission Counsel. Felicia Johnson, are you on?
Yes, I am.
Okay, thank you. I just wanted to ask, is the Wayne County Commission, do we have the ability to issue a health order to issue or to do a mask mandate for public schools?
Commissioner, no, I'm not aware of any law that would authorize this body to put a mask mandate in place.
Okay, so the responsibility for issuing that mandate would be upon the health department?
Yes, upon the public health officer.
Okay, that's all I had. Thank you, Commission Counsel. Thank you, Madam Chair.
Thank you, Commissioner Dobb. All right, and thank you, Director Jordan, for your update and the work that you're doing. We will move to, actually not the next item. I want to shift everything. We have quite a few email public comments, as well as there may be several individuals on the line that would like to make public comments. So I'm going to now open it up for public comments.
There is
Madam
someone in
Clerk?
the chat, Stephen Warnock, that wanted to speak.
And each person has 2 minutes, please. Thank you.
Yes, hi, thank you very much. My name's Steve Warnock. I live in Grosse Pointe Park, and I'm a family medicine and psychiatry physician. I'm here to strongly advocate that Director Jordan and Officer Osterberry do a mask mandate for all of our students. Our boards of education simply are not doing it, and they're not doctors. It's dangerous. You are the health professionals. We need you. Also, Director Jordan, you just misspoke. I'm not trying to throw you under the bus, but kids with asthma can wear masks. Actually, if you look at the MDHHS, recommends that kids with asthma wear masks. I have patients who have COPD with oxygen who wear masks. There really are, I can count on my hand, maybe 1 or 2 people who can't wear masks, and they're probably under the age of 2 or have severe craniofacial deformities. So I strongly disagree with that. And I think that you need to read some research, because that's out there. The anti-mask people who are not following science are gonna really take on to that. We need you to be courageous. Our kids are gonna get sick. In Wayne County, we have vulnerable kids. I am the medical director at the River Rouge Teen Health Center. I have vulnerable asthmatics there who need to wear masks. We cannot wait till kids die to do this. And that's what's gonna happen. Our governor is not acting, unfortunately. All doctors are behind this. Vaccination is definitely our best way to get out of this. I have 3 kids less than 12. I'm scared to send them to school, and they have no major health things, and neither do I. I'm about to get my booster probably in a few weeks. I'll be fine, but a lot of people aren't. We are in too vulnerable of a community to not do this. You need to lead. Thank you.
Thank you for your comment. Did we have anyone else?
Nobody else said anything in the chat, but there are a few hands raised. I don't know if you want to do that first before I read the email comments. I
Let's
see
take
Erleen,
the hands.
Erleen Seymour.
Hi there. I also sent a more thorough email comment, but to everyone in the room, I'm Dr. Erleen Seymour. I live in Northville. I was also the Carmanos lymphoma doc last year and rounded on COVID patients, saw them through death, talked to their families, was boots on the ground for the first and second peaks. Saw my colleagues have their kids get inflammatory syndrome as we rounded, but were somewhat secure that that was very rare at the time. That is not the case anymore. We are friends with colleagues in the South. We have friends just around the area. They're telling us they are seeing the ICUs get filled up. They are seeing kids get hospitalized. I have a 4-year-old and an 8-year-old in Northville Public Schools. We're tired. And we know exactly what you're doing. We know who could do something about this and who is not. So honestly, just cut the crap. We as doctors know what truth is out there. We know what journals you know about. You need to take the courage to do the right thing for our kids. Okay. So I'm going to take that as my 2 minutes. I have an email detailing that we need universal masking, regardless of transmission rates. These designer transmission rate recommendations don't make sense from our school boards. They're all over the place in our county, including mine. We're going back to our school board this afternoon. We're tired. How much more do you want us to do? That's it.
Thank you. I also see Commissioner Terry Marecki. Did you want to say something now or you want to wait?
No, thank you, Commissioner. I'll wait till the audience communication.
Okay.
If I even decide to say anything at this point.
Okay, thank you. All right, Madam Clerk, we can continue with public comments.
Blajitsa. I'm sorry if I butchered it.
No worries at all, and I apologize that I'm mobile, else I would have the camera on. I have 2 children. They are 8 and 11 years old, and I live in Grosse Pointe Woods. To say that I am dismayed by the lack of courage in our greater community is an understatement. I believe in public education. I grew up with a Michigan public education, and I was taught to listen to the experts and our physicians and our leaders. For all the commissioners on the line, I want to thank you for the time you put into helping our children and communities, but I feel like this health department that is failing us. My son has asthma. He has no problem wearing a mask, and he's 8. I am his mother. If I tell him to eat his broccoli, he eats his broccoli. Where is the courage for our children? Please take the politics out of this. It is a piece of cloth that can lower the chance of my son and my daughter giving COVID to my parents and their great grandparents. Where is the courage in all of this? We have the most amazing physicians dedicating their time to our children in our communities. They are not being listened to. Teachers are leaving school districts. Teachers are not being heard either. They are the ones talking to our children and educating our children. When I was a child, my teacher was the god and the goddess. I listened to what they said. They're not even being supported today. With all due respect, could you please consider a mandate before we start school and put our kids in person? Let them have an uninterrupted, drama-free school year in person with a piece of cloth, and let us review the numbers and see where we are in the next few weeks. I know your jobs are hard. I'm part of the crew of parents reflating your emails. We're only doing it to keep our community and our children safe. This isn't fun. We want to be spending the rest of our summer in the pool and outside and running around with fireworks, not doing this. This has become another job. Please do the right thing and have the courage to do so. Thank you for your time.
Thank you. Next comment, please.
Susan S.
Hi, I appreciate Director Jordan's attention to the data and consideration of next steps here. I am here to encourage an indoor mask mandate, as with other commenters. I am a Wayne County resident, but my profession and educational background is in public health. And I have been using the daily Wayne County Health Department information to map out data both for Wayne County and my specific community. And my community's current 7-day average rate of COVID cases is higher than the state of Michigan, even with a high rate of vaccination. So we know that this is an upward trend that's going to advance even worse when school starts. Our school boards are making up data, their own data. They are having no background in public health and just taking data and trying to create their own dashboards because they're not given the mandates that they need from the health department. We know that Delta is more contagious. We know that fall schooling will encourage more transmission. And we know that our school boards will not move until there's a mandate. There can be advisories upon advisories, and they are putting out flyers saying, here's the bare minimum, and this is what we'll do with it. So we need you to give them the bare minimum of indoor masking for our kids. I don't usually work with anecdotes. I'm a public health data person, so I go with the data. But my nephew's private school in Western Michigan started last Monday without a mask mandate. He and his classmates, many of them tested positive this weekend for COVID. Your work could prevent that. I understand in public health, sometimes people put on expectations on us that feel unrealistic and feel quick, but I really encourage you to reprioritize and make this happen. So again, along with so many other parents in my community and just citizens, please, as a health department, as this being your job, please move to make it local indoor masking a requirement immediately.
Thank you. Next comment, please.
Also, with Susan, can we please get the spelling of your last name for the record?
Sure, it's Sutorka.
Thank you very much.
Sarah Zakaria.
Hi there. My name is Dr. Sarah Zachariah. I'm a full-time psychiatrist at the Ann Arbor VA. I'm a Northville Township resident in the county of Wayne. I'm also the mother to a 2-year-old with asthma and a 5-year-old who's starting public school this fall. I am also in full support of a universal masking mandate for both children and adults, regardless of vaccination status. I do appreciate you putting out a statement with highly recommending these masks. However, I'm also an expert in human behavior, and humans tend to default to what is easiest. And sometimes not wearing a mask for whatever reason becomes easiest, even though our higher and our smarter brains tell us, this should be smart. We like to think that the risk is lower for us, no matter what. That's just what human behavior does. The Delta variant is a game changer to what we previously knew about the virus. So changing policies based on a changing disease is the educated thing to do. You do have the power to make this mandate, to take the weight off of the parents' shoulders for making this decision. The school boards, need to make this decision, and you can make it universal for Wayne County, and you can relieve so many anxieties. There's a new survey that says 80% of Americans are in favor of mask mandates. I just think the opposition is a lot louder and they follow a lot more pseudoscience. Anecdotally, my son has now been masked since the age of 4, and I see he complies with masking far greater than most adults I know. It's something he's become accustomed to, and he's much more likely to keep the mask on if it follows the rules and he does not have the option to take it off. Making masking optional confuses children and teachers on when and how to enforce a simple, low-cost, effective safety measure that can also reduce school closures and keep our businesses and our economy open. So please put the mandate in place. Thank you so much for your time and for your consideration.
Thank you. Next comment, please.
Carol Resto.
Hi, thank you for listening to me today. My comment is quite brief. I just want to say that in regards to health statements, that school boards are not listening to the words ask, recommend, encourage. Many have stated they will only recognize the word mandate. And in my opinion, I believe we need to be proactive and not reactive. And I think we really need to get the mask mandate underway. Thank you for listening.
Thank you. Next comment, please.
Leah Riley.
Hi, my name is Leah Riley. Can you hear me? Hello.
Yes, we can hear you. Yes.
Okay, great. Thank you. My name is Leah Riley. I am a doctor of physical therapy, and I'm a resident of Redford Township. And I think it's important to point out that masks do not stop the transmission of this disease, and that children's brain development is actually hindered by the increased CO2 uptake that takes place when they are wearing a mask. It is actually dangerous to our children and hurting them to force them to wear a mask for prolonged periods of time. It's hot, bacteria grows. My question to you is to consider what other health risks we're putting our children at by forcing them to wear masks. It is also a violation of freedom and bodily autonomy. And children need to see faces to learn social skills, to actually develop as a person. And there's a lot of data out there talking about how children are being behind. The children that are wearing masks are behind other students because they are not getting the proper input that they need by having free faces to breathe. So mandates are a huge disservice to our children, to their development and to their health. And I personally do not want mandates. This should be something that's up to the individual parent to decide for their children and should not be mandated by any government entity. Thank you for your time.
Thank you. Next comment, please.
Rhonda Kane.
Hi, my name is Rhonda Kane. I had not planned on speaking. However, I wanted to counter the last woman speaking. I have a son who is 8 years old and he has moderate asthma. He has had no problem wearing a KN95. What he has had problems with are coronaviruses. He has been hospitalized several times from the flu or colds. The mask does nothing to hinder his breathing. If he has problems, he'll pull it back for a second, take a breath and put it back on. The virus instead, coronaviruses are what hospitalize him. So I'm actually concerned about a lack of mask mandate. Without it, he is more apt to be hospitalized from COVID. I'm asking that the board, that the commission or the health department put in a mask mandate. We live in Northville Township and we do have our school board meeting tonight. And I'm concerned that without a recommendation from Wayne County Health Department, the board might not vote for it. So I don't think that masks hinder asthmatics. I'm an asthmatic myself. We've been wearing KN95s. I think the mask will protect us until these vaccines come out. So I'm not a physician, but I am a mom of an asthmatic. So I just wanted to comment on that.
Thank you. Any other public comments?
There are no other hands raised, but I still do have email comments.
Okay, go right ahead.
Okay.
And we're just reading the comments from others that did not just give public comments verbally, right? Okay,
Right.
Thank you.
This is from, I don't know how to pronounce it. It's JYOTHI. There's no last name. It says, "Dear HHS committee members, we are writing to share our petition for universal masking in Northville Public Schools. Please see the attached letter and 780 signatures from members of our community supporting this public health initiative. We have also included bullet points and references below. This petition is reflective of the support in our school district alone. There are also multiple other statewide petitions circulating, including one requesting MDHHS to institute a school mask mandate that has less than 5,000 signatures. We hope that this information will help you see the support and need for a mandate for universal masking of all students, staff, and teachers, regardless of our community transmission rate, until vaccines are available for all age groups." This one is from Joseph Seymour. It says, to whom it may concern, it is imperative that the Wayne County Health Department acts to impose a universal mask mandate for children in preschool through 12th grade. I am a physician in the community with 2 small children in Northville Public Schools. I completely agree with the American Academy of Pediatrics, CDC, and MDHHS that masks should be required in all schools. A tiered strategy based on local community spread will be ineffective in preventing spread from maskless children who have traveled outside the community. All children, especially those with health conditions, will be vulnerable to this very contagious Delta variant. Please do all you can to listen to the experts in this area and act to protect the health of our children and community. This is from Carla Chesney. It says, to whom it may concern, please let the parents choose what's best for their child. Masks are dangerous. Please let everyone breathe fresh air. If someone is scared, let them mask up. The health department is so concerned about vaccines, but no one is talking about how to keep one healthy. Vitamins. No one ever mentions vitamins. Stay away from sugar. Get some vitamin D, especially from the sun, zinc, and vitamin C. This one is from Jenny. She or Shy is SHIH. It says, dear Wayne County Health Department, HHS committee members, as a physician, parent of 2 young children in our wonderful elementary schools in the Northville School District, one at Thornton Creek and one at Ammerman AOPS, I am writing you to plead for your assistance in our efforts to keep our children safe by implementing required universal masking in our schools. As a leader in the healthcare and public health community, you have dedicated your careers to the advancement, safety, and well-being of our community members and our children. Throughout this pandemic, I know that you and your colleagues have worked overtime to deliver safe learning experiences for our littlest community members, and we are forever grateful for this. Working alongside you, I have dedicated my career to the well-being of our community as well in my role as a family medicine physician. Day in, day out, I am caring for Northville, Novi, South Lyon, Livonia, Farmington Hills residents, also working overtime, especially during this pandemic, to keep your family members' health my top priority. Both our careers require us to believe and fully support some key tenets the teachers in Northville have taught our little Gator and Bobcat leaders. Begin with the end in mind. Change begins with me, and be a hero. Help everyone respect others. As we navigate the school year, we have to begin with the pandemic in mind and plan to end the school year knowing that we have done everything we could to provide a successful, safe, and healthy school year for our most loved little ones. There's a lot more after that though. Like, I'm not sure if you want me to continue, but there is a lot. It will be over 2 minutes.
Okay, just read maybe towards the end of it. Maybe it kind of sums up the overall message.
It says, I strongly agree with Northville School District and Wayne in Oakland County and the following CDC and MDHHS guidelines. And it seems that our school district currently plans to implement many of them. Continue to have our students wash their hands, cover their coughs and sneezes, stay home when they're sick, screen for COVID-19 systems, clean and disinfect, maintain 3 feet physical distance, improve ventilation, and requiring masks on the bus.
Thank you. Next comment.
Okay. This is from Celeste Mentag. It says, good morning, Health and Human Services Committee members. I'm emailing my comment to present a recommendation to you because I'm concerned about medical discrimination being implemented with vaccine passports that will have a negative impact for the residents of Wayne County. Recently, a resolution to ban disclosure of medical and vaccination status was passed in Muskegon and Newaygo counties. I'm wondering if you share the same concerns with regards to protecting the private medical history and vaccination status of constituents. Will this committee be willing to put the same or similar resolution to show citizens that medical freedom is valued and discriminatory two-tier society have no place here in Wayne County? And that's the last email comment.
Thank you, and thank you all for your comments. And Commissioner Marecki, did you have something you want to say?
No, I'm all set. Thanks, Commissioner.
Okay, great. Thank you. So we'll go back to item E2. Madam Clerk.
Item 2, requesting commission approval of a retroactive lease agreement with Schoolcraft College.
And actually, can we take all 2 through 5 together? These are all lease agreements. Move approval of items 2 through 5. Is there a motion?
I'd be happy to do that motion.
And I would support it.
You go ahead.
And I'll support whoever's supporting it.
Thank you, Commissioners. All right. So let's start with E2. Is there any discussion on E2? Any questions?
Madam Chair?
Yes. Go
Yeah,
right.
it seems to me that all these they all are retroactive, but they're retroactive because we were waiting to see if FEMA funds would cover that. And so that's an understandable reason in my evaluation. And it looks like there's also a contract like for the future if vaccines start picking up again, or they're just going to play it month by month and see what happens. So I don't have a problem with any of these.
Great. Any discussion on any items 2 through 5 from any commissioners?
Yeah, Madam Chair, if I may.
Yes.
I didn't get to my hand thing yet. These originally come through as emergency procurements. Was that the original?
I don't think so.
Carol, hi, this is Carol Osterberry, Health Human Services Health Officer. And yes, that they were not able to come through as emergency procurements because they were leases. Now, the fifth one, right, the fifth one actually is for an agreement for the guidance center. And that is so that we can provide the WIC program services from the guidance center.
Thank you. Thank you, Madam Chair.
Any other commissioners? All right. Then it has been moved and supported. We will take a roll call vote. Madam Clerk.
Commissioner Marecki?
Yes.
Commissioner Dobb?
Yes.
Commissioner Anderson?
Yes.
Commissioner Colleen?
Aye.
Chair Baker McCormick?
Yes. Any opposed? Any abstentions? Motion pass. Next item, please.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item.
Public comments.
Are there any additional public comments? Any additional public comments? And we have no other emails, is that correct?
Right, no other emails.
All right. Then we will move to the next item.
Adjournment.